It's your girl BeingTami. For those who are new, welcome, and for those who are returning, welcome back. I know I have been gone for a long time, but your girl has been having consistency issues, but I am back and I'm here to give you an update as to what is happening. As many of you know, I migrated to the US and is working here as a nurse. So I'm here to just let you know how I'm adjusting and to just give you a quick comparison in terms of what it is like working as a nurse here in the US versus working as a nurse back home in Jamaica. So please stay tuned, and if you're new, please take the time to like, share, and subscribe. This channel is all about nursing, lifestyle, and travel videos. So keep on watching. What has been happening? What's the tea? Where have I been? How has it been? But to be honest, guys, I'm not gonna lie. I have been struggling. It has been a huge adjustment. Things are different, protocols are different, responsibilities are different, how things are done are different, and it's a huge adjustment. So let's just get right into the video. So first and foremost, let me just backtrack a little. When I came here initially, in order for me to meet the requirements needed to work here in the US, a lot of nurses here have to do a proficiency exam or proficiency exam. So I think it's composes of core 1, core 2, core 3, basic ECG, med surge, tele, or wherever you will be assigned. So you have to do those tests. And fast forward now, here in the US, orientation period is usually 4 to 6 weeks. I did 6 weeks of orientation, so my orientation period has ended. Comparing that to Jamaica, in Jamaica, our orientation period as a nurse when you're just starting is 3 months. Guys, initially I was cussing, like, why are we doing 3 months of orientation? Didn't we learn enough in nursing school? Why are we doing 3 months of orientation? I thought it was too much, but guys, if I could carry that 3 months here, I would gladly bring it here, because 6 weeks coming from a new country and to do only 6 weeks of orientation, I don't think it is enough, right? I don't think it is enough. But after 6 weeks here, it's bye-bye, birdie. You're thrown into the ocean and you have to survive. Goods, you have to survive. So I missed that 3 months of orientation. So yeah. So the next thing for me that I found difference was the way you sign in for work or account for you being at work. So here in the US, they use a clock-in system. So you clock in when you come to work and you clock out. In Jamaica, it's pen and book. So you sign in that you come to work, whatever time you come to work, and you sign on. So where I used to work, or at least for me, I would sign in, yes, to say that I came to work, but majority of the time, I did not sign out. Majority of the time, I did not sign out. Sometimes, honestly, I forget to sign in because you just want to start work, but majority of the time, I never used to sign out. Sometimes my supervisor would be saying, Tamara, you forgot to sign in. You need to go and sign in for this particular day because I need to submit your paper so you can get paid. Here, if you don't sign in, you're not at work. If you don't clock out, it will show that you did not clock out and all of that. So here you have to clock in and clock out. In Jamaica, oh my God, we used to take advantage of a lot of stuff in Jamaica, you know. But here, guys, here you only get 30 minutes of break time, and apparently here you can choose not to take that 30 minutes. In Jamaica, we are assigned our lunch time, so you take 1 hour for lunch. And in Jamaica, I used to work 12 hours and I used to say 1 hour is not enough. Here, working 12 hours and only getting 30 minutes, it's a huge adjustment. We used to take advantage of that. Even sometime on night shift in Jamaica, once you work night shift, you know, you get your 3 hours of sleep. Here, just 30 minutes. So never know the use till you lose it. So It's a little bit different in terms of accounting for your time and stuff. Also, in terms of staffing or nursing staff here in the US, based on what I see at the hospital that I am working at, you have your registered nurses and you have your licensed practical nurses, you have your care partners. In Jamaica, you have registered nurses and you have enrolled nurses, and then you have your PCA or your practical nurses. That's the staffing in terms of the different countries. Uniforms. So in Jamaica, once you're a nurse, everybody knows that once you're a nurse, you have to wear white. Here, different hospitals have different uniform colors here. So where I wear navy blue. Some hospitals here, the nurses wear black scrubs and stuff like that. And guys, in Jamaica, some of the nursing admin staff, they used to clamp down on persons who wear white scrubs here. You wear your scrubs and you're fine, no, nothing like that. So I think wearing scrubs and having colored scrub is kind of cool. So third thing, or whatever, no marriage, is the responsibilities here as a registered nurse, guys, is a lot. When I tell you it is a lot, it is a lot. So first and foremost, when you come, you get 46 patients. Most times it's 6 patients. When you go to work these days, you have to pray that you have 4 patients, because doing stuff for 6 patients, guys, over here, you just come in here, it is a lot. And mind you, they are not slowing down for you. They don't understand that you're coming from a total different side of the world, where you're not used to computerized stuff, you're not used to certain protocols. They're not slowing down for you, honey. You have to speed up to catch them up. So they don't understand that. So you're like struggling, like, how am I going to do this? How am I going to do that with 6 patients? And trust me, it is hard. Anybody who has migrated from whatever part of the world to the US, or at least for me and my Jamaican friends, I know it is a struggle to manage 6 patients. It's a lot. But what I find here, though, we have different persons for different responsibilities. So in Jamaica, like for example, in Jamaica, we are the nurses. So we were the ones who put patients on oxygen, NEBS patients, suction patients. Here, they have respiratory therapists. So they're the ones that are responsible for giving their patient the NEBS treatments and suctioning patients and putting them on oxygen, evaluating them and stuff like that. So I thought that was pretty interesting. So some of the things that I find, or some of the responsibilities we have as nurses here in the US, is, which is again very different from Jamaica, is IVs. We have to start IVs, right? So we have to administer IV push medications here in the US. We have to know our basic ECG. You need to know what rhythm your patient is in, and you need to understand that the patient is paced and all those technical ECG stuff here. If a patient needs to be consulted to a specialist, for example, gynecologist or nephrologist, you as a nurse has to be the one to make that call. You have to call that specialist to let them know they are requested to consult with a patient here. I did not know that. That was new to me. I was like, how dare they ask me to do all this thing? I am not a doctor. Why are they asking me this? That was me initially in my mind. Not saying it out, of course, but you are the one who has to notify the consultant or the specialist that he is invited to consult on a patient that's there at the hospital. That was new. Another thing that was shocking for me in terms of nursing responsibility here is that for consents, we are the ones that let the patient sign. We're the witness, yes, but we bring the consent form to the patient and let them sign. So apparently what they do here is the doctor go over everything with the patient before, and then we are the ones who bring the documents or bring the form for the patient to sign. I don't know if that's how it's done throughout the US, but where I work, that's how I do it. Flying back to Jamaica now. In Jamaica, IV IV medications. In the hospital that I was at, we give our IV medication, Zosyn, Rocaphine, Pantex, or whatever IV meds. You give it by mixing into saline and hanging up your Buretrol. Yes, Buretrol. I don't know if American nurses know what that is, but their meds come pre-mix and stuff. And if most of their meds are IV push, but in Jamaica, you hang up your Buretrol, you hang up your saline, and you give your medication after calculating your drip rate. So that's a huge adjustment again. So most of the IV meds that I am administering, I give IV push. No hang up and wait for however long for the Pantecta to run. I mean, yes, for Zosyn and antibiotics, those are pre-mixing saline and it goes over certain hours. But for example, your DPH, your Gravel, well, not Gravel, they use Zofran here. Pantecta, stuff like that, Lasix, you push them straight and then flush them after with your syringe. So that's different here. You have to set the IV access. For some persons on that, they have to take off their patient blood. Here is different in terms of nursing responsibility. It is a lot more. Where I am at now, I'm the one that take the COVID test. So it is a lot. And things are different here. What else is different? IV meds. Here, the method of charting that they use is a computerized based charting. In Jamaica, good old pen and paper. So where I work in the US, they use Epic. Apparently, there are different type of computer system, but I only know Epic because that's the one I am currently using. And then you have the computerized medication system, which is called the Pixel. In Jamaica, it's just the medication cupboards that we use. Once our patient is due medication in Jamaica, you get your Cardex, you go to your medication cupboard, and you take out your Carvedilol with you 10 o'clock, you check your blood pressure, patient get the meds, and that's it. Here, it's computerized, so you are given your credentials to sign into a system, and then whatever patients that you have will come up. You choose what patient you want to give meds, and everything that is due for that patient at that particular time will come up. So the risk for medication error is easier. And guys, here they don't double check certain things. So in Jamaica, once you're giving heparin, you have to pull up the heparin for another nurse, see that you're pulling up heparin. Here it comes pre-packaged, so you just take up your heparin and you go administer it to your patient. You don't need a second nurse. You also don't need a second nurse for insulin, because in Jamaica, insulin and heparin is a big thing. You need to get another nurse because you don't want to give the patient too much or too little. So in Jamaica, we had to have a nurse to witness heparin draw and insulin. Those were the two most things that we needed a witness for. Here, you just get your insulin pen and you administer your insulin when it's due. Right? You have to scan your patient, scan the meds, and then the computer say, oh yeah, this is really what is due. In Jamaica, you just check your Cardex, you check your patient ID band, and that's it. Here, it's more objective, so there's less room for errors there. So another thing, guys, here, they don't have a DDA cupboard, they don't have a DDA book, they don't have a DDA key. In Jamaica, it was a huge thing. Huge thing, I tell you. I'm sure the Jamaican doctors were tired of us saying, oh, we are check DDA, no, you can't disturb me. They're tired of it, but I guess they would have loved this system because your narcotics are stored in the same place as regular meds. So there's no one person bringing around the DDA key, and you don't need somebody to witness you pulling up a dangerous drug unless you are wasting it here. So you are free to pull up the drug here, but if it's wasting, you need a witness here. So I thought that was weird, because I know it's a big thing in Jamaica, like, who have the DDA key? Where's nurse with the DDA key? And you always hear stories about nurse bringing up DDA key and they have to change a cupboard. That's not how it goes here. Guys, here Dressing. When I got here, dressing was a culture shock for me. All they do when they're doing their dressing is get a regular clean pair of gloves, get their dressing set, clean the dressing, clean the wound, and put a cover up. Some of the wounds are left exposed, some are not. But you know, when you're in Jamaica, you're in nursing school, and they place this big emphasis on dressing and how you need to maintain sterility. You need to have your sterile gloves and sterile this, and how they fail people for certain things for not cleaning up the trolley right with alcohol and all of that. Here, it's so different. It's so different. The senior nurses emphasize these things, our college preceptors emphasize that, and boy, it was so annoying. A lot of persons fail for that, but here it's just a regular dressing, you know. It's so crazy that they place this big emphasis on having your sterile gloves when here and other parts of the world you're just doing a regular dressing. It's so crazy. But yeah, guys, so that's the update for me. As I said, I have been struggling. As we go day by day, I'm starting to master it. I'm not a computer person, but I have to be a computer person now because that's what is required. If you are an international nurse and you migrated here, if you said you did not struggle, kudos to you, because majority of the persons I know, it is a huge adjustment for them. They're struggling, and what I would like, you know, is for the nurses here to be a little bit more understanding, you know, a little bit more welcoming in terms of facilitating us with our questions, not raising eyebrows when we say we don't know certain things, because their language is different, their medical language is different, the drugs are different. Because in Jamaica, for example, we know that once a patient is vomiting, you're going to get an order for gravel, or yeah, gravel. Here is Zofran. So certain drugs that we are familiar with as Jamaicans, they don't know those drugs. Certain things that we are used to, certain pronunciation of certain things. For example, which I found hilarious, I was asking like, where's the ink pad? Where's the ink pad? Where do I get an ink pad? And the nurse was like, what? What are you talking about, Francis? What are you talking about, Tamara? I was like, ink pad, you know, the thing that you put on the bed so the patient don't mess up the bed. She's like, chalk. I was like, chalk? Yes, she said chalk. I'm like, what? I said, I call it ink pad. So there are different names for different things here. So that is gonna take some time getting used to their different protocols. You have sepsis protocol, you have different things you do when a patient cold. It's just a lot. It's a lot to manage, and some of them are not understanding. And also what I found was a big thing, I was a little bit annoyed too. They don't understand me when I talk, guys. I am currently in the Midwest, and when I tell you that sometimes my patients and coworkers struggle to understand me, and I'm speaking English, but they're not hearing me. So their way of pronunciation is different. So sometimes I go to my patient, assessing them, asking them questions, and they're struggling to hear me. Like some of them outright say, I don't hear what you're saying, I don't understand what you're saying. And my colleague will come and say the same thing, and they're like, oh yeah, I understand what she's saying, but I don't understand. But I'm like, I am saying the same thing. It's just that they don't understand me. For example, if I go in my patient's room and say, do you want any pain meds? She don't understand me. I have to be, do you want any pain meds? Which I thought was hilarious, because I'm like, I understand you, but you don't understand me. So they pronounce things different here. So for example, Valium, we say Valium. Here they say Valium. So it's a huge adjustment, not only the fact that you have to get used to how they do things here, the different protocol, the different meds, you also, it's a different culture. So certain things you have to get used to, like how they pronounce things. Here in Jamaica, we don't really look out for certain things. Like here, alcohol withdrawal is a big thing here, and certain drug withdrawal is a big thing here. So they have different protocols for that. In Jamaica, we don't really screen for those things. So it's a huge adjustment, and I don't think our I don't think our orientation period here has covered a lot of things. So there's a lot of things that we don't know what to look out for, and because we don't know, we seem incompetent. And some of the nurses here, they are not afraid to let you know that you're incompetent. Like, I've heard a lot of nurses say that the international nurses, they don't know what they're doing, but they're not wrong. We don't know what we're doing, but at the same time, why can't you have an environment that fosters our learning? You know from day one that we're from a different part of the world, so it's gonna time for us to adjust. So if you're an international nurse and you're struggling, girl, you're not by yourself. Just hit me up in the comment section, comment down below. Let me know where you are practicing as a nurse internationally, what is different, how did you overcome your struggles and stuff like that. For me, I'm taking it one day at a time. I just go to work, go home, I ask my questions. And guys, as international nurses, you need to understand that there are days you're gonna feel like crap. There are days you're gonna make mistakes. Hopefully, there's none that is life threatening to our patients, because we can't afford to make those mistakes. But you're gonna make those mistakes. You have to be willing to learn, because we're on a learning curve right now. We're at the bottom of that learning curve, but we will reach the peak of that learning curve. You just need to be patient. Um, just holler at somebody that is in the same predicament as you, and you build your vibes. And you cannot take it personal. Do not take it personal when they say you don't know or you're incompetent. And you cannot take it personal, because that will demotivate you. You will not want to go to work, and you're gonna feel down. You're already in a strange place. Don't make it hard to yourself by taking things personal. And if you want to cry, cry, but don't cry in front of them. Go home and cry, and get yourself together and come back and refuel for the other day. So yeah, that's my 2 cents on my updates. If you have any questions, just let me know. And guys, what I want to do a question and answer whenever I get to 1,000 subscribers. Please guys, help me to get to 1,000 subscribers. I will be doing a Q&A whenever I get there. And I like that some of you guys have been reaching out to me on Instagram with your questions. I even answered a nurse in the process of migrating from Nigeria. You know yourself. Thanks for that email. I hope my email and my response help you to make a decision. I like it when you guys comment under my videos, so keep on doing that. Hit me up on Instagram like many of you have been. Please guys, thanks for the support. I really appreciate it. And remember to follow me on Instagram at BeingTami. So follow your girl, help me get to 1,000 subscribers. You understand? But on a different note, I would just like to take this time to ask your support in donating to a GoFundMe page for a co-worker of mine in Jamaica. Her name is Tamara Coley. Yes, she's my namesake. She's a wonderful person. Her heart is really nice. She's having her period of struggle. She was recently diagnosed with colon cancer stage 4, and this is somebody who eats healthy, exercise. It's just that she's going through a period in her life where she needs help. And I know a lot of nurses watch my channel. A lot of you probably have supported her already, but I'll be leaving in the description below the GoFundMe page, so please just click on the link and donate whatever you can. If you know her personally, that's good. If you don't, just please help out a fellow nurses. We have been heroes to so many persons. Let us be heroes to ourselves. So as I said, the GoFundMe link will be in the description below. And if you cannot afford to donate to the GoFundMe, guys, just send up a prayer for her and just bear her up for me. So Tamara, if you're watching, I love you. We got you. Okay? Alright, anyways guys, thanks for watching. Keep your support, and let's get ready to hit up 1K subscribers. Bye.